identified quickly, there is definitely hope. Today I want to talk a bit about diabetes. Now, ladies and gentlemen, are you ready?
Yes.
If you're ready, let's do it for the one and only Dr. Yeboah. Hello, Dr. Yeboah. Welcome. It's good to have you. Please have a seat.
Thank you.
And thank you so much for being here.
Thank you.
I hope everything is well.
Everything is doing great.
Right. Now, today I want to talk about diabetes, but as we are going to talk about it, we also want to talk about the late former First Lady of our country, who goes home today. And I know that, you were quite old enough when she was the First Lady. So what do you remember most about her?
Oh, well, I think what I remember is those days she formed the 31st December women's movement in Accra. Those days were in Mokola at the time, helping at the shop. So she was very prominent around that time.
Yeah. May her soul rest in peace.
Yes.
Now, today we are talking about diabetes, like I said earlier. And, we have heard too many times, like sometimes we hear, diabetes is caused by sugar. The other times we hear, it's not caused by sugar. And the other times we hear, it's hereditary. Today, we want to get to the bottom of it. What really diabetes is, the causes, what we can do to prevent it. And just in case you are told that you have diabetes, how do you stay alive? So first off, we want to know what diabetes is, Doc.
Okay, well, thank you. So diabetes, we can define it simply for the public is when your blood sugar levels are elevated. So when you eat, any food you eat is broken down into sugar or glucose, and this is absorbed into the system. The body will produce insulin or a hormone to store whatever you eat. So overall, anything that you eat is stored in your body, and insulin is what will do that for you. So when you have diabetes, there's a problem in that mechanism, and therefore when you eat, instead of the sugar being stored well in your system, it stays high in your blood, and then you can pass it out, and then it causes a lot of problems. So in a nutshell, if your blood sugar level is high, higher than normal, then we can say you have diabetes. That's a simple definition that we can.
Right. Now, again, we want to find out, is it caused by sugar? Because you said when your blood sugar levels are high. So is it caused by sugar?
It's not sugar per se, in terms of, granulated sugar, but any carbohydrate or food. As I said, food in general, all foods, when you eat, the end product is glucose, which is quote unquote like sugar. But if you eat sugar in itself in excessive quantity, then your blood sugar levels will go higher than when you eat maybe protein or fish or something like that. So eating sugar in itself is not good, right? But it's caused by, deficit. So let me just give you the causes so you understand. So there are various types of diabetes. As I said, insulin is very important. So there is a type which is called type 1 diabetes. It's not very common. About 5% of the population of diabetics will have that. And in this condition, your body does not make any insulin at all.
That's a type 1?
Type 1.
Okay.
So when you eat, instead of you producing insulin to store the sugar, the body does not produce insulin. So the blood levels of sugar is going to be high. And that would pass through the urine, and then you begin to urinate a lot. So that's one form of diabetes, complete lack of insulin, type 1. The second form, which is type 2, is the more common one. Maybe 90% or 95% of the population of diabetics will have that. In this situation, the body makes insulin, but it's not adequate or it's not utilized properly. And therefore, it's just like having inadequate insulin. And we tend to have it in people who are overweight, very big, very fat, there's a family history, and all those kind of stuff. So that's the second group, type 2 diabetes, which is much more common. And then there's a third group, which is found in pregnancy. There is a lot of stress during pregnancy. So during pregnancy, certain people, the stress level would elevate their blood sugar levels. And that also is not good for the baby. And that's what we call gestational diabetes. So these are the three main forms. And other tiny, tiny forms.
Now let's break it down. How is it that some people don't produce insulin at all for those that get the type 1 diabetes?
So those tend to be genetic. There's something called autoimmune. So the body produces certain antibodies, and sometimes they can attack the body's own production, and then it will destroy it.
Okay.
So that's what happens in those particular group of people. It's an autoimmune disease that destroys their own production of insulin.
Okay.
But the bulk of it is the people who have it, but it's not enough, or we call insulin resistance. So because they are overweight, then the body needs more. So the insulin that is being produced is not adequate.
So that one is more of a lifestyle.
That's where lifestyle changes improve it.
Okay.
Exactly.
Right, but the type 1 is more of, a hereditary thing.
Hereditary, family history, autoimmune problems,
okay.
etc.
Okay, all right.
In the let me just add that for the type 2, there's also a familial aspect as well.
Okay.
So it's not only purely lifestyle, so it can be what we call multifactorial. So if you have a family history of diabetes, then you are more prone to having diabetes.
Okay.
And therefore, if you get overweight, then you are more likely to get it. So that in one family, with a family history of diabetes, one who is well controlling the diet, exercise, etc., may not have the disease, whilst the other one, if he's overweight, not exercising, would have that higher risk of getting diabetes.
I see. Now, let's go to the gestational diabetes. I have a friend who actually got it, but right after giving birth, it went. Some too, it stays in their body. How come?
So there is a stress factor in diabetes, or in pregnancy. When you get pregnant, the body produces a lot of hormones, etc. So these hormones cause a certain amount of stress. So with that stress, those who are prone to having diabetes, if you are overweight, family history, and incidentally, ethnicity is also part of it.
Really?
And blacks, as a general, we are more prone to getting diabetes than the Caucasians, if you look at the numbers. Okay. So when you are in that group, and then in pregnancy, you get overweight and etc., then you can get gestational diabetes.
Is there a reason why blacks are more prone to it?
I think it's more genetic.
Okay.
So because, familial history, genetics.
Okay.
Blacks are more prone than whites. We are more prone than the Latinos, and then more prone than the Asians,
Wow.
So it's in that order. So if you have the gestational diabetes, after pregnancy, once the baby comes out, that stress level of pregnancy with the hormone levels all would come back down to normal. So most people will resolve. So the majority of people actually will resolve gestational diabetes. However, the statistics show that about 50% or half of those who have gestational diabetes will go on to develop diabetes sometime down the line, after 5 or 10 years.
Okay.
So that once you have it, you're at high risk, and therefore checking your sugar regularly, exercising, eating well, and all would help you prevent or decrease the chance of getting full-blown diabetes.
Is diabetes curable?
Not exactly, but it's manageable.
Okay.
I mean, I get this question a lot, as whether you can cure it or not. It's a very important question, actually, because sometimes what happens is that people go to other areas and they say, don't take the Caucasian medication, and because we can cure it, you don't take medicine. And if you don't understand it well, then you'll be at risk. So because 90% or so have type 2 diabetes related to obesity, overweight, insulin resistance, when you lose weight, your insulin resistance will decrease, and therefore the body's own insulin will become more effective. Right? So with that, if you get diabetes and you're overweight and you are type 2, aggressive management, lifestyle, weight loss, being very active, watching your diet, actually bringing your weight back to your normal, ideal body weight, will cure roughly 10 to 15% of patients with diabetes.
Wow.
Bringing your sugar back to normal.
To the BMI level?
Yes.
The weight.
Your weight's back to normal, about 10% or 15%. Blood sugar levels will go back to normal, because now your body weight can handle your own body's production of insulin.
Right.
However, once your sugar level is high, statistics show that maybe half of your production of insulin has gone down already. So you'll still be at risk. So if you go down to normal and you don't follow up, then you could increase your sugar levels again. So those are the category that you can say they are cured, but really not. Normally, I would label them as diet-controlled diabetes.
Okay.
Because at any time, if you revert back
to that lifestyle.
The lifestyle, then your sugar will go back high.
Okay.
But the rest of the
at that time, do you go off your medication?
You can, yes, in those group.
Okay.
10% roughly.
Okay.
But the majority, which is 90%, and then this is where I don't want people to misunderstand me that, oh, the doctor said it can be cured, so I'm off my medicines. Because the majority, 90%, will need something.
Okay.
And this is where sometimes there's a misunderstanding. So the person is taking the medicines, then he stops it. Then suddenly sugar goes so high and he has to go into coma and all that. So I'm not advocating that when your blood levels improve, you stop the medicine.
Okay.
Because normally the levels have improved on medications, and therefore you need to have a maintenance.
Okay.
Right, so that's, to prevent it from coming back.
Prevent it from coming. So you have to speak with your doctor and let your doctor give you the medication to manage it, right?
For the majority of people, you take medicines for the rest of your life.
Wow.
Yes.
Especially the type 1, eh?
Type 1, you take insulin, that's correct.
Okay.
Because you don't make insulin, you take insulin all the time, type 1.
That's type 1.
Type 2, you take medications.
Okay.
Most type 2 diabetics will need medicines control for the rest of their lives. Only a few, as I said, 10% or so, plus or minus, would be diet controlled. The majority would not be, and therefore it would be good to take medicines to control it.
What's the right lifestyle one has to live if the person is diagnosed with diabetes?
So the key thing is to maintain your body weight. Of course, in Africa, we have a higher body weight and big bone compared to the Caucasian. So we can calculate your body mass index, know what exactly yours would be, and then you try and maintain that. And that involves the food choices. So low carbohydrate diets, or low fatty food, low sugar, as we were mentioning, because refined sugar causes higher blood sugar levels than non-refined.
Okay.
So you eat less of those. So you watch your diet.
Is the brown sugar non-refined?
The brown sugar has certain elements, so it's non-refined, but it's still not too great.
Okay.
So
it's not too great. So which is great?
Well, if you can avoid as much as possible, it's better. Normally, we would not say do not eat it at all, but yes, very, very minimum if needed. Or you can do
honey.
Honey also has some sugar, so the quantity becomes important. Right. Or Splenda and equal, and those artificial sweetness can also be useful.
Better. Okay.
Yes, to decrease the sugar levels.
Okay.
But having said that, if you eat rice, it's going to turn into sugar. If you eat banku, it's going to turn into sugar. If you eat, so that is also the other issue. So it's quality and quantity.
Right. Okay. So then you have to cut down your rice intake.
High carbohydrate intake.
High carbohydrate.
And then you choose more of vegetables, fruits, vegetables, protein, wheat, fiber, things with less carbohydrate quantity, what we call the low glycemic index foods. So they have less sugar in them.
Does fufu turn into sugar?
Yes.
Wow.
Fufu, banku. Generally, every food turns into sugar. The body will turn every food into sugar. That's the bottom line. But it's just the quantity and the amount of sugar that each particular food will produce. Some will produce more higher blood sugar levels than others. Right. So at the end of the day, you have to eat, but it's just the type and quantity. For instance, if you have a plate of food, half should be vegetables, a quarter carbohydrates, the other quarter proteins.
Okay.
Right? But usually in our local diet, the whole plate is full of carbohydrates, and then there's a small protein landing on the top.
Yeah, no vegetables.
No vegetables at all. So,
they'll tell you the vegetable is in the sauce.
Exactly. So that's what you need. Very, very minimum carbohydrate content. Yes.
Fantastic. Now, Doc, most people that get diagnosed, I have seen some say, oh, you can drink a glass of wine. Wine is better than any other alcoholic beverage. Can you clear that for us? As a diabetic, is it okay to drink wine?
I think quantity is the issue. Quantity.
Okay.
I know someone, actually a family member, whose sugar level is good, diet controlled and doing well, went somewhere, had some wine, very nice, and had quite a bit. And the following day, the sugar was extremely high. Oh. So she says, I'm not taking wine anymore.
Okay.
So I think it's the quantity. If you have just one glass, it's reasonable. But if you're taking a lot, Because overall, alcohol also turns into sugar at the end of the day. So that if you have a lot of it, then you're going to turn to sugar. All alcohol, wine, beer, vodka, and everything. And of course, at the same time, too, the soft drinks will also turn into sugar.
Right.
Coca-Cola, Fanta, I mean, they actually have a lot of sugar in them.
Right.
So you just got to be really cautious and particular and just minimum, very, very minimum.
So is it best you don't drink it at all?
If that's the way you want to go. Okay. Sometimes it's good not to say, don't take this, because it becomes very difficult in terms of lifestyle. So I think moderation and looking at the quantity becomes important. I had an experience with someone who said some time ago, had a baby, and blood pressure went high, and they asked her not to eat salt, and then and pepper. And our local people, when you have a baby, they like to bring you soup. So they brought her Banku with no pepper and no salt. And really she felt like vomiting. So generally I think we want to go away from that kind of advice, but it's very minimum. When you tell people decrease your salt intake, then instead of, so this the amount I have, I take. So I've decreased, I'm taking just half. But even this is also too much.
Right.
Just very minimum to make the thing taste. Or spices, for instance. So look, decrease your, I take this amount, like 2 handfuls, so I'm taking 1 handful. That is also too much. Maybe just a tiny bit. So that is why some doctors will say, don't eat it at all, which also is an issue. So very, very minimum to taste, because the effects is going to be an issue.
Now, if you don't take good care of yourself when you're diabetic, what are some of the diseases that it could lead to?
Okay, so as I said, your blood sugar levels go high. That is where it starts from. So when your blood sugar levels go, I'm just going to go through what we call some pathophysiology. If the sugar levels go too high to a certain point, then it goes beyond the capacity of the kidney to hold back on the sugar. So you begin to pass urine.
Is that where the kidney failure comes in?
Right. I'll get there.
Okay.
So you begin to pass a lot of urine, and that's sugar. And as the sugar is going out, you pull water with it. So you put a lot of water, so you also get dehydrated.
Okay.
So typically, the person will present with urinating a lot. They get dehydrated, they feel thirsty, they drink a lot of water. And then they are losing weight because the food they eat is not stored. So there's weight loss, they get tired, they get fatigued. The high sugar in your blood, when you pass through the urinary system, they get vaginitis, they get white candida infections. That high sugar in the system also will lead to a lot of infections because the bacteria around has a lot of food to eat.
Right.
So you are more prone to infections, a lot of boils. So these are all things that should let you think, hey, wait a minute, I may have diabetes. If you get a lot of boils easily, infections easily, you have a sore that is not healing well, all should point to the fact that you might be having diabetes. Incidentally, 50% of people don't have symptoms, and that's why screening becomes important.
Right.
But before I get there, so in terms of the effects you can have, that high sugar is what causes the damage most of the time. So for instance, your blood sugar levels should be between 4 and 6. However, your sugar levels are high, 12, 13, and it's passing through your bloodstream, passing around your eyeballs and all that. So in the end, it's like your eyeballs are sitting in this sugar solution for several years, and then you damage your eyes. So the number one problem with diabetes is blindness from uncontrolled sugar. Right, because the sugar is so high and it's damaging your eye.
Nice.
Right, so you get blindness. Not only your eyes, every other part of your body is sitting in these high sugar levels. So your brains, you have a high risk of getting strokes, your heart, high risk of getting heart attack, your kidney, high risk of kidney damage, and then your legs, amputation, sores, etc. So that high sugar causes a lot of damage in your system. So in treatment, we aim to bring the blood sugar back to normal. That's the first thing, bring it back to normal. You use diet, exercise, etc. Then we give medications to try and normalize the sugar. Normal blood sugar is 4 to 6, so we aim at that level.
Right. So when do you realize that it's higher, above 6? Anytime it's above 6, then you...
Anytime it's above 6 is high, so you have a high risk. We will diagnose diabetes when it's about 6.5 of sugar. Then we know, look, you have diabetes. We can also sometimes do what we call the average, A1C. And the A1C is also higher than normal. We can also diagnose diabetes. And then sometimes we can just do a random sugar. So the random sugar is high, 11.1 diabetes. Some will say 7 as a fasting. You know, if it's above 7, we say, okay, you have diabetes. Imagine 1 or 2 occasions above 7 diabetes. If you do a random sugar, that means you've eaten 8 times of the day, and it's above 11.1, we also diagnose diabetes. If there's uncertainty, we can do the A1C, which is the average sugar over 3 months, and if that is also more than 6.5, we diagnose diabetes. And in some people, if it's not very clear, we do the old test where we give you sugar to drink, and we measure your blood sugar over time and see if it will come back down to normal. And if it doesn't, we also diagnose you with diabetes as well.
Wow.
So several different ways that to diagnose
with diabetes. This is quite interesting. I'm learning so much. Maybe you have questions. You're watching us this afternoon. You have some questions. You can send it to us on 055-157-5757, 055-157-5757. Dr. Yeboah is here telling us more about diabetes, because for me, you know, I've heard, I've seen, and I know people who have it, and they are really managing it in a very good way. However, when it comes to the source, that's where the issue is. You know, as much as a person is managing it, anytime the person gets a sore, it never dies. Why?
Because of high sugar levels. So if you have diabetes, it really affects your system. You know, it affects several different aspects of your system. The sugar is high. That high sugar levels will provide food for bacteria, etc. So when there's an open wound, the bacteria have a lot of food to eat, and then they don't die. So we got to bring the sugar back to normal. It also affects your blood vessels, the endothelium. They also are inflamed. So all these lead to, you know, decreasing wound healing. And then also sometimes there is blockages. You know, over a long time, the high sugar levels, diabetes, with other associated diseases, high blood pressure, cholesterol, will cause blockage in the arteries, what we call atherosclerosis. So there is decreased blood flow into the areas, you know, the limbs. And you need blood flow for healing. Right, so if the blood flow is decreased, then you don't get enough blood going to the limbs to help it heal. So the key thing is to avoid sores. That's the key thing.
To avoid sores?
Yes, as much as possible. I mean, sometimes they are unavoidable, but one of the things you can do is you make sure your shoes are not too tight. Because excessively tight shoes can lead to blisters, and the blisters can, you know, easily burst and get a sore. So comfortable shoes that, you know, you can wear shoes with cushions in it, so that, you know, when you wear them, it's very comfortable. You avoid going into areas where there's thorns and stakes and things that can cause a scratch on your skin. You avoid all those things. So various things that increases your risk of getting a sore, you want to make sure that you avoid it. You know, activities that will make you fall and get hurt, and get broken legs, etc., or you want to decrease those kind of things. Yes. Right. So you don't get yourself into a situation.
I know some diabetics, you know, they try as much as possible to, like you said, to wear those shoes to prevent the blisters and all of that from happening. But what if they're in the kitchen and a knife cuts them? What happens? Does it heal?
Well, yeah, if your blood sugar levels are good, then the healing is better. Right. So I think if your blood sugar levels are within the normal range, sometimes I see cases where there's a wound that is not healing, but the person's blood sugar levels is very high. So in those situations, we tighten the blood sugar control. We give them more pills, different types of combinations, or sometimes insulin to bring the sugar down back to the normal range. And then it will improve healing. If it's at the legs, sometimes we look to see if the arteries there have good flow. And if the flow is not good, we try and give you things to open them up so it will improve flow into the limbs and all that would help with the healing process.
Can one live for a very long time even though the person has been diagnosed with diabetes?
Yes. I had a patient long time ago in the 90s, was diagnosed with diabetes at age 3. And at the time
age 3?
Yes, age 3. Yes, you can have diabetes in that age group, yes.
Wow.
Yes, those with the type 1s that the body's...
So the babies are born with it?
Sometimes born, but sometimes right after that, if there are certain things that happen that affects your immune system and it shuts down your insulin production, then you can have diabetes. Right. So this guy actually, this was in the States, but he was diagnosed with diabetes at age 3 and was managed very well. And then later on, he became an accountant. And he was managing his insulin, so he calculates his insulin very well, gives him, it's very, very good. And when I saw him, it was like age 83 and was still going strong.
83?
Yes.
Wow.
Yes. And blood sugar levels were beautiful.
So age 3 to 83 years. Meanwhile, there are some people who don't even have diabetes and they don't even live that long.
Well, so if you don't take good care of yourself, I think that's the issue.
So diagnosis doesn't mean it's the end of the world?
No.
No matter how late you come to the hospital?
Early diagnosis is important. I did mention that about 50% of type 2 diabetes are undiagnosed. Because sometimes they might be urinating a little bit more. They think, oh, this is not a big issue. They might feel tired a little bit. And all those can be symptoms of diabetes, but they are not really processing it. So a lot of people are not diagnosed. So I think, and actually, let me just add this. This month, November, is Diabetes Awareness Month.
Yes.
Which we celebrated the day on the 14th. So the whole of this month, we're trying to educate people about diabetes. And one key thing is getting your blood sugar levels checked, screening. Typically, all adults after age 45 will need to be screened.
After age 45?
Yes, once a year. You can just go in for a simple fasting blood sugar to see what your blood sugar is. Now, if you have a risk factor for diabetes, then you can go earlier. From 35 to 40. Risk factors being there's a family history of diabetes, if you are overweight, if you have post-ovarian syndrome, you get sores easily, all those various, there's a family history, all those factors, then you can go in earlier and have your sugar checked so that you are diagnosed early. So once you are diagnosed, then you start treatment, aggressive treatment. Diet, exercise, lifestyle changes, and then medications. And then we follow.
And you can live longer and longer. Okay. All right. So we have Shola here too to tell us if your messages have come in or they haven't come in yet. So Shola, hi.
Hi. I'm well. How are you?
I'm fine, thank you.
Right.
Yes.
This is a conversation that I think is very important. I don't think a lot of people are privy, once again, to such topics. So when we say diabetes, someone is like, oh, I'm sure it's just attached to sugar, when you eat too much sugar. But I know that there are a lot of things that can lead to it. There are some of the foods that have glucose, and there are some of them, the starch we take in there, into our body, can all give us diabetes if we don't take them in the right amount. And Rosie, if I do anything, let me say thank you to Abora_Sika_ for my outfit. I really, really love it. You can go and get yours as well. Let's get into our messages. This one says that, Doc, my eyesight is terrible and I have diabetes. I'm scared I may go blind. What do I do?
Okay, so I think the earlier you have it checked is better. You have to take a two-pronged approach. One, you have to see an ophthalmologist, who look behind your eyes to see what is going on there. It can be from any other eye problems, but you can also have diabetes or diabetic retinopathy. And then, of course, you have to see a diabetologist that will look at your sugar levels and control it. Because the sugar levels are high, then the eyes is going to get worse. So you can come in, we can tighten your blood sugar levels, and then we'll have the eye doctor take a look. Sometimes we may have what we call retinopathy. There might be some bleeds behind your eyes from diabetes. So they may treat it with laser treatment and things like that. And then we also control your blood sugar levels. Very tight control.
Right. So you can go to the hospital, like you said, and get it checked. And also your blood levels as well. I lost my mom to diabetes. If we had all this information, I'm sure it could have been avoided. I'm even sad. This one says that the way Ghanaians take this illness lightly shocks me. We need to take good care of ourselves. Doc, my distant family has diabetes, like my aunties and a few of my uncles. Do I stand the risk of getting diabetes?
Yes, so it's a risk factor. Normally we'll say first degree relative. So I think you need to just check it early. If you are age 35, once a year, you can go for blood sugar levels and check.
Are people like that, do they have to live a certain lifestyle to prevent themselves from getting
Yes. If there's a risk factor, then lifestyle modification is important. I think we've mentioned that, but let me just go over that. It's two-pronged. One is weight, making sure that your weight is within ideal body weight, your BMI is good, decrease your weight, decrease food intake, caloric intake, high carbohydrates intake, so that you keep a good weight. And then the other is activity, exercise. Sitting down all the time, not doing things is not good. Minimum walking, 30 minutes a day, 5 days a week. That's the current recommendation. At least 150 minutes per week of activity would increase your metabolism and decrease your risk of diabetes.
Right. This one says that what are the common symptoms of diabetes? I think you said that one is weight gain. At least you need to move. Doc, is there, are there any...
weight loss.
Sorry.
Okay. So
forgive me. Weight loss.
Let me go over that because it's important. So the symptoms, I kind of describe the parts of yourself. But the one is urinating a lot.
Yes.
Frequent urination, especially at night. Number two, getting diarrhea, so being very thirsty. So you are urinating and you are drinking water all the time. You need to have your sugar checked. Number three, losing weight. Weight loss is very, very key. Weight loss is very key. Number four, you get tired.
You are losing weight without
any reason. You got to check diabetes.
Really?
Yes.
Someone will say, I'm healthy now because I'm losing the weight.
No, you got to check diabetes. Thyroid, overactive thyroid can do it, but also you got to check your diabetes. Because the food you eat is passing through the urine. And so you are not storing it, and therefore you lose a lot of weight.
Wow.
Sometimes you also get hungry easily. Yeah. So you are hungry, you are eating, and you are losing weight. You get tired very easily because the body is not utilizing the sugar that you are coming to the system. You get tired easily. And then you get sores easily, boils and things like that. For the females, vaginitis, white, frequent white, you need to check it, check your blood sugar levels. So I think those are
right. Rosen, this one says that, hello, doctor, please, does every diabetic patient have blood pressure?
The statistics is about 50%. 50% of diabetics will have elevated blood pressure and vice versa. If you have hypertension, also another 50%. Somewhere between 50 to 70% of people will have both of them. So we didn't mention, but once you have diabetes and we are treating you, we check your blood pressure, and also we check your cholesterol, because the same 50% may also have high cholesterol. These three tend to go together, and we treat them at the same time.
Okay. All right, Dr. Yeboah, thank you so much for being here. Before you go, tell us a bit about Yeboah Hospital, because I know I've been passing by all the time. I say that I'll visit Yeboah Hospital, but I haven't visited it yet. But very soon I will. Not as a sick person.
Just to come and say hello.
I'll just come and say hello.
That'll be fine. That'll be fine.
Yeah.
Oh, okay, beautiful. So Yeboah Hospital. So it's actually Yeboah Hospital and Diabetes and Endocrinology Center. So overall, we do everything there, but we also focus on diabetes and endocrinology. Endocrinology is we deal with hormones, specialty in hormones. So high blood pressure, uncontrolled diabetes, female problems, hormonal issues, and all that. And we have other specialties too available. We are at East Legon, right opposite the East Legon Police Station.
Right.
And if you want, as 057-6815-115, you can get us.
Thank you so much, Dr. Yeboah, for being here. We are very grateful. So please call Yeboah Hospital. They are available for you. I love your face. What a person. I'm like, oh, that place is nice. I'll definitely visit, not as a patient.
Yeah, just come and chat with us. That would be nice.
So our guest has been Dr. Yeboah, and he has told us more about diabetes. If you know anybody who is struggling with diabetes, please take the person to Yeboah Hospital. They are there to support you. They are there to help you. I think they'll even counsel you before they put you on any medication if need be. So make sure you go to Yeboah Hospital. They do other things as well. So go there anytime you are in need with regards to your health. Thank you once again, Doctor.
Thank you for inviting me.
All right. So on that note, we'll take a quick break. When we come back, we do have more conversations for you. Do stay.